Well, hello. Welcome to Black Men Speak, a podcast that highlights ordinary Black men doing extraordinary things. I'm your host, Keith Dent, and I know we missed a week, but I'm glad to be here because we just wanted to make sure that we lined up the right guest tonight. And by George, I think we have found the person that's going to talk tonight. Um, as you know, we're in part two. This is part two of our transformational health series for Black men. And we're going to be unpacking some of the obstacles that are around Black men's health in really living optimally. And so, um, as we discussed in the first episode around this topic, statistically speaking, Black men live 7 years less than just other men's groups. And some other statistics, 44% of Black men are considered overweight. 37.5% are obese. There's a higher rate of diabetes and prostate cancer among Black men. And then there's a high suicide rate. And crazy enough, it's the third leading cause of death for men ages 15 to 24. So there's several reasons for that behind this issue, and it's mostly because of the access to healthcare. There was a study that I found by the Health and Human Services that was done in 2019. Men in general are 24% less likely than women to actually seek medical care or going to the doctor in general. For Black men, it's about 50% where they don't actually go to the doctor. So if they do go to the doctor, then one of the challenges have to deal with either they're getting bad information, they don't trust the doctors, and which causes them to not go regularly. So some of the things that could be avoided or treatable are not being done because of the fact that we are just not going to the doctor often enough, which is leading to some of the issues. So, but there is a man, that we're going to be interviewing tonight by the name of Aaron Perry, who is had some of those challenges himself, and we're going to be talking about that tonight. But he turned, and I don't want to give out any away of his story, but he turned his trial into triumph, not only just for him, but also Black men that lived in his era. And so we're going to be bringing him up in a minute, but he's the founder of Rebalanced Life Wellness Association. So it's an organization that is trying to provide Black men and boys an opportunity to live fuller, healthier lives. And so, Aaron, welcome to the show.
Hey, thank you. Thank you for the invite.
Oh, you're quite welcome. So we're just going to get right to it. Like I said, you're the founder of Rebalanced Life Wellness Association, and I just love the title because it's not balance, but rebalance. And so that means kind of, if you dissect the word, meaning that we're off balance. But I'd love to know what kind of led you to open this health center.
Yeah, first foremost, thank you for inviting me to be here. It's crazy. Over the years, I noticed the discrepancies, the disparities, but when you're in it, when you're 20-year-old college athlete, and you're at the top of the game in terms of athletics, and then all of a sudden 4 years later, you're not doing the 2 workouts a day, you're not competing competitively, but you still are trying to maintain that the college physique, and just staying on top of that. But I didn't notice in the community at the time I was living in Iowa, um, moved back to Wisconsin, but I did notice that there was some concerns with folks and men talking about a lot of different health challenges. But again, I wasn't in that space that I'm in now, but I do recall hearing that. And so all of a sudden I'm 29 years of age, and then I get diagnosed with diabetes. And I was really concerned because I didn't think at the time that I looked like the stereotype that I used to see in terms of what a diabetic looked like. But now I have this, and I have to change how I live. But for me personally, there was a psychological aspect of being diagnosed with diabetes, and then learning that I have to now change the way I live, and that included taking insulin, you
Mm,
know, 2 to 3 times a day. And that was very difficult for me because growing up in the inner city of Milwaukee, I'd always promised my mom that there was a lot of things I wasn't going to do, but I was going to graduate from college and I would never use drugs or needles. And then all of a sudden, I'm diagnosed with diabetes. And the one
mm.
thing that I promised my mama that I wouldn't do, I have to use needles, giving myself insulin injections just to stay alive. And so, literally, the first year of being diabetic, man, I was just rebelling. I just no, I made my mama that promise. I'm just and I was rebelling and I was hurting myself. And
Mm.
finally, I just came around to one had nothing to do with the other. And of course, my mom would want her son to live. And so I finally slowly came around, but I did struggle psychologically with being diagnosed with diabetes and then being told I have to give myself insulin injections.
Okay. And just kind of backtracking, what sport did you actually play?
Yeah, I played basketball, ran a little track, and then I dabbled in football, but basketball was my sport. Now I
Basketball was
was
your
pretty
sport. And
solid.
and you played in college?
Yes, I did.
And
Yes. I'm sorry.
where did you play?
Marycrest University, a
Okay.
Division III school in Davenport, Iowa. I mean,
Okay.
it's since closed, which is too bad.
Oh, okay. Oh,
Uh,
wow. Yeah.
but yeah, we put it on the map. It was one of the top NAIA colleges in the country. So
Oh, wow.
yeah.
Okay. And so so it's interesting to say that you rebelled. And so when you in dealing with the black men that are in your area where the center is, you know, do you find that you kind of hear about some of the issues that I described earlier uh, in the study where um, people are just mistrusting their doctors or they are not going? Was that kind of your story as well when you were going through your journey?
I was always um, in a position where I strongly advocated for myself. I was just a big advocate for myself. And so any harm that I was doing, it was self-inflicted. I was doing
Oh,
it to myself. But I also, in talking with some of the other guys and hearing that, guys didn't have insurance. I was fortunate that I, at the time, went to school and got my education. But I was meeting a lot of brothers that they either dropped out of high school or didn't attend college. And so I saw that the disparity on them, when they particularly talked about, having some health problems, it was just that, I'm gonna wait it out, or, I know it will get better. And although I didn't know these individuals, I made a mental note of why is it that, some of these brothers are, struggling with health issues, but they're not seeking help. I didn't understand, but again, I was in a different space. I was not that big advocate for them. But looking back at that, now I know why I'm in this space. I think this is God given. I'm just following the plan that's laid out to me. But overall, I mean, I just became a health advocate because of exactly what you're referring to, just constantly seeing the challenges in our community and knowing that the system, can be and can do better. And so I said, if the system is not willing to do or be better, then we have to do it ourselves. And that's when I kind of took on that initiative of just reaching out to men and just letting them know, hey man, if we're gonna make this work, we may have to do this on our own. And that's how I came to the decision of bringing healthcare to the barbershop, And but I'll let you we'll
Yeah,
get
yeah,
to that later.
yeah. We're gonna definitely get to that, but just for because I'm on the East Coast. I don't think I've been in Wisconsin yet, but I'm sure to get there. Because, um, but kind of describe Dane County. What's kind of the makeup geographically, or
Mhm.
also financially? What is the makeup to give us kind of a concept of where you live?
Yeah, so this is a easy one. So about 7 years ago, one of the leading publications listed Madison, Wisconsin, as the best place to live, the number one place to live in America. At the same time that publication came out, there was a report that was done called the Equity Report, and that report listed Wisconsin as the worst place in America for Black people to live.
Mm,
And so you have this number one place to live. You have this organization that did an internal, in depth reporting. And it was deep, it was well done, but it really got to the heart of what was happening in Madison, Wisconsin. And so sometimes you can say it's the tale of two different stories. But for more, but there's actually about 15,600 Black men in Dane County. That's Madison, Dane County. There's about 15,800 Black women. So in terms of men, make up 6% of the male population in the county in which I live. About
mhm.
250,000 people that live here. But it's also a college community. And so,
Right.
you have a lot of educated individuals here. You also have, a lot of, with the development that you see, beautiful complexes, beautiful apartment complexes going up, you know. But the reality is, there is a small portion of our community that will never be able to live in those. I mean, because, I raised the question once about who are these apartment complexes being built for? And one of the construction guys said to me, he said, "Oh, this is for the Epic employees, and Epic is the big software company.
Mm,
And they've just completely revitalized, medical health records." And so that's what he said. No, this is for the Epic employees. And we know that Epic pays their employees very well. And so it was just a snapshot of where this city, Madison, Wisconsin, in comparison to a lot of the other cities, you see a lot of this development going on. But if you are not in a position to be able to provide for yourself and live, comfortably in these places, you're going to struggle. And unfortunately, health is always put on the back burner when you're struggling to make ends meet and you're trying to be a good provider for your family. Sometimes healthcare gets put at the bottom, and that's hence where the whole Rebalanced Life Wellness Association come in.
so you're saying, ironically, the complexes that are going up is for a company that's called Epic that deals with healthcare,
Oh yes, yes.
and but our people of color are having challenges via healthcare because
Yeah,
they can't,
yeah.
one, they can't find housing, among other things, that's
Yeah.
affecting their health. Oh wow,
Yeah,
interesting.
it is a challenge, and and I mean, hats off to the companies that we have here. I mean, they've been doing some great things for the community, and by no means is this an Epic issue. Epic is just a great company, and they pay very well. But the reality is, when you look at a lot of the housing that's going up, and you start looking at the low income housing that seems to keep going away, it's a challenge.
Okay, so yeah, so then let's touch upon uh kind of the framework of the rebalanced. Life Wellness Association. And what made you decide to create the program in the way, which I think is fascinating and very kind of, I guess, insightful on your part because of how it's created. So I'd love for you to go into that a little more.
Yeah, so I mean, in a nutshell, I mean, I used to be a police officer. I did that job. I didn't care for it. I'll be the first to admit that, because you can't arrest your way out of a problem. You can't arrest your way out of poverty. And so
Mm,
that's when I was a police officer and I, took men in custody, I would always look back in that back seat and I would say, is there anything that could have been different that would have prevented me from having you in my back seat right now? And guys, would say, I'm $100,000 in debt and child support. I'm never going to get out of that. I'm homeless. Nobody
mm.
cares. I have a I have a heart issue. Haven't been on my medication, but and those are some of the challenges that men were stating to me. And so early on in my law enforcement career, I made that connection to these social issues. And so if I booked someone into jail, I showed up the next day with job applications. I showed up with housing applications. I said, if I was a part of taking your freedom away, I want to be a part of getting your freedom back. And so I started coming in and just trying to be a support for men that I arrested. And I didn't realize I was doing community policing before it was even popular. There was no name for it. It's just a commitment that I made. And unfortunately, the system was very uncomfortable with me showing up to the jail. Wait a minute, you did your job. Why you here? You got a personal relationship with these guys?
Oh,
And
really?
yeah,
Wow.
yeah, and that was a challenge. And that's when I realized that it wasn't a system for me that I wanted to be a part of, and so, but that was really how Rebalanced Life started to form. And so looking at the challenges that these men had, then I started looking at more of the health disparities. And that's when I realized, I served on a couple of committees. I served on a health committee, patient family centered care committee. I served on a diabetic patient advisory committee, and listening to the concerns of folks that were in the medical field. They were completely well intentioned, but they were not very well informed in what I found. And so I saw my role very clearly that I wanted to be a bridge from Black men in the community back to the healthcare system. And so this is how my organization started to be formed. And then ultimately, what I realized is that I would hear questions that would come out in some of the meetings that I attended. Black men just don't seem to care about their health. Why don't we just keep getting that $5 copay and call it a day? And I remember thinking that's not accurate. I think the issue is we're not in the right place trying to reach Black men. And so
Mhm.
ultimately, that's what led me to reaching out to the owner of a barbershop with this idea of putting a health center and ultimately a health clinic in a barbershop.
Wow. I mean, that's pretty insightful to think about, and very. It's almost perfect because I mean, one of the centers, besides the church, where you will see a large congregation of Black men, and I mean, for younger guys, yes, maybe the basketball court, but not old folks, but the barbershop, everyone has to get their hair cut. So when you brought it to their attention to start this, what was their initial response?
Mhm. The before I did that, I actually researched the barbershop. I mean, I went way back to the 1900s when there was the Jim Crow era where the barbershop was everything. The barbershop was a pharmacy. The barbershop was a place where men could go just to feel safe,
Mm,
to feel welcome. And so I went back and I researched a lot of what the barbershop meant to the community. And I ended up just kind of bringing that back forward. And I said, I want to, in essence, replicate that and make the barbershop be a place where healthcare is what the community needs, especially these men. And so I studied that, and then I finally set up a meeting with the owner of it's called JP Hair Design. It's Madison's largest black barbershop. So I set up a meeting with him, and I pitched it to him. But I knew that my pitch needed to be really sharp, because I can imagine as a barbershop owner, being one of the largest black barbershops in the community, I'd imagine he gets hit up all the time by people wanting to sell stuff and people wanting. So I knew my pitch had to be spot on. So we went out to breakfast. I pitched this to him, and I'll never forget what he said. He said, "Aaron, I hear a lot of presentations, and most of the time they're red light." He said, "Today I finally got my green light." And
Mm.
said, "Let's move forward with it." And so neither one of us knew what to expect, but at the same time, he was honest too, in that he didn't utter the words, "Because you're a former cop, I don't know how this is going to be received," but I think that he was prepared to provide me cover. And so all of a sudden now, I'm asking men, as a former cop in a barbershop, a black barbershop, now I'm asking them to trust me, you know.
Right.
And I could tell you, it was not easy in the beginning. And the owner of the barbershop absolutely did provide me cover. He co-signed for me, because there were guys that sometimes I remember walking in to the barbershop once, and if I can make this statement, because we're keeping it real, but
Yeah,
the
absolutely. This is
statement
a real
was,
show.
yeah, when I walked in, I heard this guy say, "Is this motherfucker back again?" That, I was shocked, but I understood this was their space, and I'm a former cop, even though I did the job, not very long,
Mm.
but I was still, in their space. And some of them pushed and they pushed and they pushed, but I didn't go away. I
Mm.
stayed true to my vision, and I did not cut corners. And I knew that by me coming with an open heart and genuine intentions, that ultimately they would see that. And that's what happened. They slowly started coming around. I would go out and, "Hey man, let's get that blood pressure," and some guys would be, resistant, but then guys would come in, and they would let me do their blood pressure. And then all of a sudden we brought in nursing students from one of the colleges. We would bring in physicians that would assist us with diabetes testing. And all of that was, we were building our brand, but more than anything, we were building trust with black men in our area.
That's fascinating because I mean, the fact that they saw you as a police officer first and not and kind of a black man second, that's trying to provide a lifeline to these brothers. But then I think, was it initially fear that kind of kept the men from actually trusting you, or was it because of who you were, what your profession was?
Right. We've had a lot of time. COVID-19 forced us to really take a step back and kind of evaluate a lot of things, but mostly when, when we announced that we were in a pandemic and things got really bad. Remember, all the barbershops were shut down. And all of the governors, said, we're going to shut the barbershops down until we can get this pandemic under control. And I remember thinking, gosh, we worked hard to earn trust, and now the barbershop is going away. Are we going to have to start this all over again? And how are we going to be able to do this? And so I got together with a small group of my leadership team, and we decided to host weekly Black males mental health and well-being support groups. And in essence, we were like kind of doing exactly what you're doing, and we did it for 90 minutes on a Saturday. And we just started inviting, public health officials, We invited Lieutenant Governor Mandela Barnes. He's a young black man, the first lieutenant governor. Obviously, young guy, sharp guy. We brought him in, because we were still trying to build trust, but we also wanted to help guys stay sane because we were feeling that we were losing a lot of our men in terms of just I can't go to work, I can't provide for my family, and so we started doing those support groups, and that's how we were able to really kind of maintain a lot of what we were doing, so that when they started lifting the restrictions a little bit more, we were able to at least say, okay, we didn't lose a lot of ground in terms of that trust that we developed. And so again, it was just us, for one, proving our worth and showing guys that this is an investment in you. We care about you enough that we're offering this service. It's not much, but we are still offering this because we care about you and we care about your mental health.
Great, great. So also what's great about your program is that you just don't, it's just not a walk-in service. You offer some very interesting and great programs to kind of engage men. So what are some of those programs, and what has kind of been the outlook from those programs that you
Mhm.
community?
Yeah, so probably the biggest thing that we've done is, you know, we let the men guide what we do. We can sit and say that research says all of this, and I'm not anti research. It's just that we've gotten as far as we have by listening to what Black men stated that they want and that they need. What we do know is America has been extremely good at listening to the voices of Black men, but they've received a complete failing grade on hearing our pain. You can listen to our voices, but if you're going to ignore our pain, are you really helping us? And that is kind of what we saw. And so we started doing a lot of focus groups. We did tons of surveys, and based on those, that's how we designed Rebalance Life Wellness Association. When I talk about patient centered care, we are barbershop men centered care. I mean,
Yeah.
that is what we are. And so it's been, so it's easier when you are meeting men where they're at, and you're providing specifically what they want. And so, again, I took good notes. My staff took good notes. Every single person that walked into our men's center, whether they got that beautiful haircut and came in, we didn't look at them as this big barbershop. We looked at them as individuals because they all presented with something different, and that's how I believe we've been able to be successful.
That's great. Um, and so one of the things you mentioned is earlier is that the doctors didn't really have a real clear understanding of Black men's issues in the community. But now, since you've been open, what has been what feedback have you gotten from the Black or the medical profession?
Yeah, one of the things that I can tell you is that we have a health organization in our community. Excuse me, SSM Health. Um, I tell you, top of the line health center, health service, health organization. They saw what we were doing, no others did, and they came on board and supported us. And from the time that SSM Health has came on and supported us, we have started to see some of the other health systems that have come on and work with us. I've been invited to do presentations with the medical school, first and second year medical students, but we also work with a lot of the physicians. Excuse me. And with that, I can tell you, we have really um, brought everyone kind of together on the same page, so to speak.
Oh, okay. That's wonderful. Because I mean, I think that's has always been the biggest challenge is that, and some of it bears out which I didn't go into depth in the study that was done in 2019, is that there wasn't a clear understanding of what our issues are, and Black women in general as well, not knowing what are some of the issues that we face, and to being able to provide proper treatment, and to recommend certain things because they're not really sure of what some of the issues we have, and then with the lack of um, people of color in the profession, trying to always find that person that we can trust, and is very hard to do. Um, so above you right now, there's a thing that Perry Family Free Clinic. So sounds like that is kind of the next journey of your organization. So I'd love to hear why you decided to do that, and
Yeah.
what has been the experience so far.
Yeah, and I apologize. I'm having a, a cough attack at the
No
wrong
worries.
time. But with the Perry Family Free Clinic, um, this is dedicated to the legacy of my late mom and dad. They embodied it takes a village to raise a child, but also it takes a village to help improve the health of those that are struggling. So we created this for it's a clinic for uninsured and underinsured Black men. That was important because as we did a lot of the surveys, we started looking at the men who were chronically using the ER for their health care. We knew
Mhm.
that this was a demographic that or a group that we needed to focus on. And so that's kind of where that came from because, one of the things that we cannot have is we cannot have our men, those brothers, Black men that are in the community that are struggling. We can't ignore them. We have to extend a hand and lift them up. And that's what this is all about. So we provide primary care services. We provide a diabetic foot care clinic.
Mhm.
Everything that it takes to help these men be okay, that's what we're going to do.
That's wonderful, and because I think by them going using the emergency room, that's also cost to the hospitals that
Yes.
they weren't getting back
Yeah.
because they didn't initially, but they couldn't turn them away because that is not part of the I guess their credo as hospitals. So so what are some of the besides the diabetes foot core, what are some of the other uh treatments that you can receive?
Yeah, so like I said, we're primary care, organization right now. Very excited, and again, we're part of the free and charitable clinic network. And so there's, obviously, if men come here and they have insurance, we will work with them on getting in to see their doctor, but we have to be careful of not seeing men that actually have good insurance. Although we have gotten a lot of men that have said already, Aaron, can I just see my doctor at your clinic? Very profound, but we
Mhm.
understand it because this place is, as you can see on the back of the wall, this represents what we are trying to do. We are trying to meet these men where they're at, but we also wanted them to understand that this is exclusively for them. Now, we know that health disparities cuts across all ethnicities. So no one will be turned away. But this is, we're focused on, treating, Black men and getting them the care and making sure that they know that once they walk out of here, they now have a medical home.
Oh, great. And is your staff primarily African American, or is it a very diverse staff of doctors?
Yeah, one of the things that I've learned in doing this work, we there is a challenge in Wisconsin, particularly in Madison, Wisconsin, to have Black physicians. They're just hard to come by in this area. And so I learned early on in doing the surveys and doing the focus groups, men were telling us, you just bring me someone that will look me in my eye. If I'm sitting in the doctor's office, they're not focused on their computer, but they're looking me in the eye. You bring me that person, and I will welcome whatever they can bring to my life. And so we learned that yes, it is important that you be, culturally diverse, but we also learn that if that is not an option in your area, you bring the best people into those men's lives that are going to also build on the support and the trust that you provided, that you've established. And so I hear more from the medical community about we know we're not black. I hear that more from the medical community than actually from men. And
Mm,
so I tell them that if you come and you're willing to roll up your sleeves and help these men get better, help them understand and make that connection to good health, then you are welcome here. And that's the way that I try to describe how it is you can move forward when you don't have, doctors of color. Now, there are some men that have just flat out said, you know what, I'll take my chances. I'm just going to wait until I get a black doctor, and I respect that,
mm,
So we try to provide whatever we can as non physicians. We try to provide that. So, one of the workarounds that we do, so inside my men's health centers, so we have three men's health centers in three different barbershops. So we have literally two computers in each location. One is set up to the Harvard Medical, the other one is set up to Mayo Clinic. And so if men come in and we're unable to have a doctor or a nurse on site, then we go online and we research whatever their struggles and challenges are. That replaces us from trying to be what we're not, and we're not doctors. And
mm,
so in essence, for instance, we had a guy that came in and he was talking about the fact that his girlfriend or wife maybe had kicked him out of the bedroom. She said he was snoring like a bear, and he was upset, rightfully so. So he asked, man, can you guys help me? And I said, well, I mean, did she tell you anything? He said, yeah. She indicated that when I'm sleeping and I'm snoring, it sounds like I stop breathing. And I said, have you ever heard of sleep apnea or sleep study? He had never heard of that. And so what we did is we logged on to the Mayo Clinic and we researched what sleep study is. We researched what sleep apnea is. And so now here it is. This client of the barbershop is reading this and he said, Aaron, that's me. That's me.
mm,
And so we ended up saying, okay, the next step is we're going to help you get a sleep study. This young man did not have insurance. And so one of the things that we do is we brought in an insurance navigator. There's an organization here called Covering Wisconsin, and that is what they do. They help people get affordable health care. So we brought this company in, and we actually have an insurance navigator on site now. So anytime someone comes in and they don't have insurance, we have a person that can sit with them right on the spot and help them get that process started. And so, having Covering Wisconsin come in, we ended up helping this gentleman get started with getting his insurance. And then we actually help him set up a sleep study. And I'll never forget, I made sure that he made it to the sleep study because I actually went and picked him up, you know, and
right,
I dropped him off because I said, brother, we cannot have you missing this appointment.
right,
And
because he had to.
so
He had to stay overnight.
yes, yes. So I ended up, pick him up and I dropped him off and I said, you're gonna be good, man. You're gonna be okay. Okay. He was nervous, of course. But obviously he came back in and afterwards they said, you definitely need a CPAP machine, And that was so powerful because 2 months from the time we had that interaction, he came back into the barbershop and he walked in and he yelled out loud, I'm back in the bedroom, you know, and then we all started laughing. But you know what? That was profound to him.
Right.
he's back in the bedroom. And we joke, so so what is the missus saying? And he said, yeah, she said, I purr like a little bear now, but I loved hearing how that interaction was so different from what brought him to us. And the one thing that I can say, that is what we pride ourselves on with the
Mm,
Perry Family Free Clinic. We're saying that from from the time you walk in our doors, we're going to give you 60 to 90 days to have your life be completely in a different place than what it was when you walked in the door. We're going to have a community health worker working with you. We're going to help you if your issue is housing, if your issues are substance abuse or mental health. We're going to work with you. And it is our goal that within 60 to 90 days, you will be in a better place. That is the goal of the Perry Family Free Clinic.
that's awesome because you not only saved a life, you also saved a relationship. So,
Yes.
being I'm a relationship coach, so that's just fast. That's just a great thing because something as little as that, because he could have looked at that in a very different way.
Mhm,
That she doesn't love me or what have you, but it was really just a simple
mhm,
thing is just getting checked out to figure out what the issues were.
mhm.
And
Yeah.
that's awesome.
Yeah, and it's
Um,
it's it's actually interesting that you say that. One of the other, and I shouldn't say incidents because that's not correct, but one of the other gentlemen that came in, he said to us, he said, "Hey man, I think it's time." He was one that every time we would ask to get his blood pressure, he would always, "Oh man, I don't want no bad news today," and he was like, "You can get it next time and next time," and then all of a sudden life brought him in. And so he came in and he closed the door behind him, And one of the things we pride ourselves on in the barbershop is that we tell guys, you don't have to close the door. This is the barbershop, man. We roll up our sleeves for each other. But the guy came in and he closed the door. So that told us that he wanted some privacy. And he said that he was attempting to perform with his partner, and he just didn't have any success. And she told him jokingly, "You better figure this out. I'm gonna get me a younger man." And he
mm,
said that he knew that she loved him. He said, "That's not the issue. I don't want you guys to have a bad view of my girl. That wasn't the issue." He said, but it still hurt that she was joking about that, trying to make light of the fact because she didn't want me to be in my head. But he said it still hurt.
mm,
And so he came in and say, man, I got to figure this out. And so we finally ended up getting a blood pressure reading from him, and it was significantly elevated. And so what we told him is just like we tell everyone, one high blood pressure doesn't mean you have, or one elevated reading doesn't mean you have high blood pressure, but you want to keep monitoring this. And so we encouraged him because he was a guy that had good insurance. And we encouraged him, we wrote the numbers down on a card and we said, take this to your doctor and share this with your doctor. And so he ended up, I remember coming back in, I want to say about the same time, maybe a month or 2 months later. But he came back in and he had this little bottle in his hand and he shook the bottle. And I was like, what is that, man? I said, is that blood pressure medication? He said, no, man, this Viagra. You know, like, oh, all right, brother, But he
yeah,
said that he was also taking his blood pressure medication.
right.
And he said that in having those conversations with his doctor, initially he said he was uncomfortable bringing that up, but he said he remembered our voices in his head.
Mm,
They cannot help you if you don't share what's going on with you. And so he just broke down and said, I need help. I love this woman too much to lose her. And so now he's got his blood pressure medication. He's has his little pills that's gonna help him out.
yeah,
And you know what? He's doing well. We don't have to have that conversation anymore because
Right.
we moved on. But there was times that he would come in and he would be, thank you, thank you, thank you guys, thank you. He's like, no, man, you did the work yourself. We
Right.
just kind of, nudged you a little bit.
And also, which is great, he was a he came from a position of strength as well, because at least he had an idea of what the problem was, as opposed to going in blind to talk to
Mhm.
the doctor. So at least the doctor couldn't give him false information, because he at least knew that, yes, I do have high blood pressure. At least I had a reading and to say, oh, there's some more uh, tests that need to be done. Because what will happen, a lot of times I've heard, uh, and there was a quote by someone earlier, by the name of Tim Davis, who's a friend of mine. He had to get an operation. When he's a younger guy, but when he went to the doctor, they would tell him that, oh, it's okay, you don't have any issues. And even though he had an idea, he did, until it got to the point where he had to have an operation. So
Mhm.
that's so it's a great to at least have a position of come from a position of strength, and that's what the clinic or the association allows men to do, to come in with at least some knowledge of what's going on with their bodies.
Mhm. Yeah, and again, this is all happening in their space. It is also led by Black men,
Mm.
and this is what I pride myself on the most. Our clinic, we just opened 3 weeks ago.
Oh, well,
Yeah,
congratulations.
thank you. Yeah, we've seen 11 patients so far, and it's been very well received. But what was really profound is the very first patient that came in. I remember after his appointment, he asked me if he could just have a seat in the lobby area, and I said absolutely. And I walked away doing some other things. Came back, he was still sitting there, and I said, "You good?" He said, "Yeah, man, I'm good." He said, he said,
Mhm.
this what you guys are doing is amazing. He said, Aaron, there's no way that I would have ever gotten an hour and a half with my doctor. He said, I had an hour and a half with the doctors here. There's no way that I would have ever received that. And he said he just wanted to sit and take it in. And that of all of the testimonies that I could have received, that told me, and he was the very first patient that we saw,
Mhm.
that told us that we may be in the right place and onto something. And now we had 10 other patients that have come in, and it's been very well received. So we're really excited about the future of this, and we're hopeful that this can continue.
Well, and that's a great segue. So, what are the plans for the future of Rebalance Life Wellness Association?
Yeah, so ultimately we want to continue to strengthen this. Right now, we're only open, one day a week from on Thursdays from 1 p.m. to 5 p.m. Our goal is to try to see 10 men in between that time. So every other week we're open. But in between that, so we do the free clinic twice a month, but we also are working with our Edgewood College nursing students. And so we have a group of nursing students that come in under the guidance of their professor, who is also, a medical person, but they lead a diabetic foot care clinic. And so those are the things. So every Thursday, we are able to provide this community, especially uninsured and underinsured Black men, we're able to provide them a very critical service. We have now become their medical home. And so I'm really pleased with that. But more specifically, what are the plans? We'd like to be open at least 2 or 3 days a week. That would be the goal. But we know that we are not there yet. Just like with anything, the community will support this. We put information out in social media, and ironically, more women are the ones that are responding, saying, "I'm going to get my guy over there." And so we're really pleased that's happening.
Yeah, shout out to Black women. They hold us down,
That's right.
and we have to start doing the same. But that's another show. So we'll get to that. So I always like to end the show because it's you're doing such great work, as well as all the guests that usually on the show, but we don't necessarily talk about ourselves and how we're feeling. So my question I always end is, what's on your mind, right now
Yeah.
as a black man
You
in the
know,
city?
what gives me concern, being a former cop and watching that craziness that played out in Washington, during the inauguration and leading up to it, that gives me grave concern about where we're headed as a country. We know that there has always been a divisiveness, so that gives me some concern. But we also know that we are a people of faith, and I think that that's going to carry us through. But I am concerned about the state of the divisiveness that we're hearing between the two different parties, and specifically one in particular. I am concerned about that, but we're going to just continue to do the work. We're going to continue to wake up every morning. We're going to talk with our men. We're not just going to listen to their voices, but we are going to hear their pain, and we're going to respond to that. I truly believe that what we've created here with my three barbershop health centers and now this free clinic, I believe that this is the future of healthcare if people are serious about reaching black men, the black community. I think that the early indications clearly are we've hit a home run. Lastly, I will say again, we've served since we opened 5 years ago with the barbershop health centers. We've served 5,900 black men. That's providing them with at least 4 hours of daily preventative, non-invasive preventative health screenings. That is almost 38% of the black male population in our county. Our goal by the years out, we want to be hovering right at around 50% of the black male population. I don't think that there's a health system in our state that can say that.
Bravo, bravo. And you're good. And are you good?
I am good. I am, because when you have to practice what you preach. I sleep well. Obviously with COVID, there's been a little weight gain, so I actually signed up for a half Ironman in September. And so I'm slowly starting to get ready for that because, I got to drop that, I got 20, almost 25 pounds that I want to take off. But
Mhm.
more than anything, I just want to be able to be a role model, and practicing what I preach. If I'm encouraging and telling men that they have to get themselves in a better place health wise, I got to continue to lead by example. So, but no, I'm really good. I've always practiced self care. I have a psychologist that every so often I'll call him up, say, "Hey, man, I need to be reset." you know. So I'm not afraid to, you
Yeah,
can't lay down on the couch anymore, but I'm
right.
not afraid to call him up and just check in with him. But I remember he and his wife, they worked together, but I'll never forget, they said, "We really like you, Aaron, because you check in for yourself." And that's what I would encourage anyone that's listening, is to find that place, find that therapist, find that person that you can check in. That doesn't mean that you're crazy. That's saying that you want to be a better person, you want to be a better provider, but more than anything, you want to be there for your family. Because one of the things that I share with our men is that, okay, if you don't take care of yourself, that big house that you built, that beautiful wife that you have, you don't take care of yourself and you die early, some other sucker's gonna be lying his head on your pillow. And believe it or
Right.
not, that actually gets a lot of guys' attention.
Mm,
But that's the reality. We got to be here for our partners, and our wives and girlfriends and whomever. But we got to do our part.
right. And one thing you wanted to say as we close is that you are a role model, um, because you're leading with your heart. So I just wanted to leave you on that note. that you are already a role model because you saw something that you could do, and you worked with nothing actually, and brought it to the community, and it has, in turn, I think it has, people are taking note, and you have transpired the medical industry. And I do hope for good things and great things that will happen um, with your organization, not just in Wisconsin, but on a national level as well.
Yeah, yeah. Thank you for that. And I'm part of the Black Men Run organization. So I'm the national director of health, wellness, and disease prevention for Black Men Run. We
Mm.
have 52 chapters across 32 different states, and so it gives me joy to be able to, talk about health and encourage all of the different chapters across the country to do that. But if people are in the community and that are listening and that they want to be a part of a strong group of men that get together and just focused on health and focus on that social connectedness, I would encourage them to find a Black Men Run group in their community. There's, again, we have them across 32 different states.
Okay, great. Well, Aaron, I just want to thank you for joining this evening, and I really look forward to hearing more about your Rebalanced Life Wellness Association as well as your Perry Family Clinic.
All right, thank you so much for the invite.
Oh, you're welcome.
All right, take care.
Okay.
All right.
So, folks, that was truly wonderful. And I just want to implore Black men, if you haven't started to participate in the Black Men's Transformational Health Challenge, that you might start today. One, try to go to the doctor and get a checkup. You can at least go to your pharmacy. I think they give screenings. And if nothing else, talk to your barber, because your barber is your trusted friend, and share what challenges you may have. You never know; they will encourage you to go to the next level and get what you need to get done. So, thank you for being here tonight. This is Keith Dent from the Black Men Speak podcast. You can find previous shows on Spotify, Libsyn, as well as Apple Podcasts. So, have a good night. Peace.